Coming back with some more rad safety effects and responses. Two terms I want us to differentiate are somatic effects and genetic effects. Somatic effects are going to be specific to the person who was exposed to radiation. So they're limited to the exposed population. Genetic effects are harmful to the future generation. So my children, you would see the effects in them. So somatic to the person, genetic to the next generation. Local versus general. So local somatic effects are limited to the exposed individual and the specific area. One of the main terms you're going to see here is the erythema, or the reddening, and say the path of the radiation therapy beam, something like that. General somatic effects are, again, because it's somatic, it's the individual, but general could be the entire body. Short-term versus long-term effects. So short-term effects, we're going to see fairly quickly. We're going to see them in hours, days, or weeks after exposure. Our main short-term will be epilation, erythema, nausea. Acute effects from a high dose, death, or acute radiation sickness. Long-term effects will be effects that are seen longer after exposure. So months, years, could be decades after exposure. Our number one that we don't see for a while is usually a cancer. Leukemia has a latent period of 5 to 7 years right before we see it. Cataracts are a long-term deterministic. Okay, and then the genetic effects, obviously. Right. So acute versus chronic are, again, two terms I want to kind of separate for you. Acute is not cute, I say. All right, acute is a large dose delivered over a short amount of time. This is a big dose. It has greater lifespan shortening, more harmful. I want you to think Chernobyl. Atomic bomb, right? Dropped. That's a big dose in a short amount of time. Chronic is small increments of exposure over a long period of time. I want you to think about your patient who's in chronic pain. They've had pain ongoing for a long time. Or you're a trauma patient who's in acute pain, is severe pain. Okay. So acute versus chronic. Organ and tissue response. So I think if we can specify the ones that happen into certain areas, obviously the eye is going to be your cataracts. This is a deterministic effect, so it's non-linear and it has a threshold. Thyroid, linear non-threshold. Breast, I think cancer falls under the stochastic side. Skin, when we talk about skin, we're going to talk about skin reddening. The epilation, losing of hair, these happen at a threshold at a certain point. Gonadal areas, or for permanent or temporary sterility, again, will fall at a certain dose. For females versus males, knowing kind of when we would see it. The embryonic and fetal effects, obviously these are specific to the timing within pregnancy, depending on what trimester it's in, or how many days or weeks of the process. Okay. Lethal effects are induced by radiation before or immediately after implantation. Pre-implantation, which is 0 to 10 days, is the most sensitive stage to the lethal effects. Okay. Malformations is characteristic of the period of major organogenesis, which is when the main body structures are formed, especially those in the most active phase of cell multiplication.